Recent trends reveal a sharp rise in cancer cases in India. Awareness around preventative steps, early diagnosis and treatment can help reduce the burden of the disease and help in improving survival rates. Cancer treatment has seen significant advancements. While standard of care treatments like surgery, chemotherapy and radiation remain crucial, newer advanced treatment options are also available in our country that offer hope to countless patients. Incidentally, June is Cancer Immunotherapy Awareness Month. And to observe the occasion, we're joined in studio by a distinguished panel of domain experts because we owe it to ourselves and to our loved ones to be aware. With that, welcome to our special feature, I.O., a public awareness initiative by MSD Pharmaceuticals. Allow me to introduce our guests. We have with us Dr. Rajat Saha, Unit Head for Head and Neck Cancer, Rajiv Gandhi Cancer Institute and Research Center, Dr. Vineet Govindagupta, Additional Director and Unit Head Medical Oncology, Fortis Hospital, Shalimar Bagh, Dr. Bhuvan Chugh, Consultant Medical Oncology, Max Super Specialty Hospital, and Dr. Ankur Varshni, Consultant Medical Oncology, Medanta Hospital, Gurgaon. Gentlemen, thank you so much for taking the time to speak with us. And Dr. Rajat, I'd love to kick off the conversation with you. If you could help outline some of the leading telltale signs, warning signals, if you will, or symptoms of cancer that require immediate medical attention.
Cancer affects almost all parts of the body. So if we start from the top down, we have got head and neck cancers, which is very much prevalent in our country.
Right.
What are the telltale signs which can warn the patient? Any non-healing ulcer in the oral cavity, any change in the voice,
Sure.
any difficulty in swallowing, which is persisting for a long time. All these should warn the patient for any head and neck cancer. Suppose the patient has some bleeding from the oral cavity in his vomiting, or the patient has observed some streaks of blood in his sputum.
Right.
That should warn the patient as regards any lung cancer or any stomach cancers. So that is also quite prevalent in our country. Amongst ladies, if she is observing any painless lump in her breast, which has developed over a period of 3 to 4 weeks or months, any change in the nipple size or dimension,
Right.
that should warn her that she may be developing a breast cancer. And she should take immediate attention with a gynecologist or a family doctor. If a lady observes any abnormal bleeding from her vagina, that should warn her that something may be wrong in her vagina, cervix or uterus. So that these are the signs of uterine cancer, vaginal cancer and cervix cancer, which is also very prevalent in our country. Suppose the patient has got some abnormal bleeding in his stools. That also is one of the signs of intestinal cancer, colon cancer. So these are some of the signs of cancer, and we should definitely not overlook it and go to a nearby family doctor or gynecologist for a checkup.
Thank you for sharing that. And coming to you now, Dr. Vineet, while these signs or symptoms shouldn't get overlooked, oftentimes they do, and that leads to a delay in diagnosis, right? What does that typically mean in terms of patient outcomes, and what are some of the leading factors that contribute to this delay in the first place?
It's a very, very big problem for our country. The fact that, the cancer not caught at the early stage.
Right.
Because see, the outcome difference is very large. A patient, as he goes from stage 1 to stage 4, his survival or outcome decreases exponentially.
Sure.
So the idea to get a good survival or good outcome in cancer is to catch it early. So recently there was news about Joe Biden getting diagnosed with stage 4 prostate cancer. So I will tell you that for every oncologist, it was actually a surprise, because prostate cancer in the West, usually they have screening program where they try to catch it early by doing blood test and clinical examination.
Sure.
And I would say the vast majority of patients over there, they are not diagnosed in stage 4. So I think what needs to be done is that we need to catch these cancers early. The most important modality is what is called screening. So ideally you don't want to wait for symptoms.
Right.
So for example, if we have a lung cancer patient, by the time he starts spitting up blood, it might already be stage 4, and it's difficult to treat at stage 4.
Sure.
So ideally what you want to do is, if a patient is a heavy smoker at high risk of lung cancer, you might want to do CT scans once a year to try to catch the cancer before it becomes symptomatic.
Right.
For a lady in a certain age group, you want to do a mammography once in a year or once in 2 years to catch a breast cancer before it increases to a sufficient stage. For ladies, you should want to do a pap smear to catch cervical cancer early. So I think the most important thing which can help us catching them early is screening. Other than that, there are other problems in our country like access. So poor people may not have access, people either because they are not aware about the testing which they need to do,
Right.
or because they don't have the funds or the doctor availability or the resources.
Sure.
They might be having symptoms, but they don't go. They don't meet the doctor, and when they actually become so troubled that they have to run to the doctor, it might be too late.
Yeah.
They might have advanced stage, very difficult to treat.
Yeah.
So I think these are the two major things which need to be dealt with. One is screening, and second is improving access. I think these will improve the proportion of patients we catch at an early stage, and that will actually dramatically improve the survival of our patients.
And increasing awareness around those realities is of course critical, right? So coming to you now, Dr. Bhupan, let's switch gears and let's talk treatment modalities, right? Which typically constitute perhaps radiation, chemotherapy, surgery, right? What distinguishes these treatment modalities from one another, and what sort of situation or patient scenario calls for which treatment modality?
So it's a very important question. What we are basically trying to understand is how is cancer treated and what are the various modalities for it. Surgery per se means physically removing the cancer via an operation.
Right.
That's what the surgery means. The second part is the systemic therapies, for which chemotherapy is an essential part, the other therapies being the targeted therapies and the immunotherapies. So they're all the therapies which are administered systemically. It may be done via intravenous injection, via an oral tablet, but they all constitute the systemic therapy, and they're able to control the disease in the blood as well as the local disease.
Sure.
And the third essential part is the radiation therapy, in which you use certain type of rays to treat the cancer locally. Now, where do we use it? And that's where the entire understanding has to be. For example, if you're dealing with an early stage cancer, and that's what Dr. Vineet was also trying to refer to, that once you are trying to treat an early stage cancer, the lesser modality will be good enough. Let's say an early stage breast cancer, a surgery, that is the physical removal of the breast lump, might be just enough.
Okay.
You may want to add some bit of radiation therapy to it. The lady may not require the chemotherapy there.
Right.
So for the earlier stage cancers, a surgery, that's the physical removal of cancer, is generally good enough. However, as the stage increases, as the size becomes bigger for the lump, more is the dissemination of the cancer in the blood.
Sure.
So when the larger is the dissemination in the blood, the more is the therapy or the modality required. So for a larger breast lump, you will probably require surgery, that's the physical removal. Also as well, you may require to deal the cancer cells in the blood with the chemotherapy or the immunotherapies there. Once you have taken this lump out and once you have done the surgery, there's some bit of microscopic cells which are residual there. You may require to attend them with radiation. So I've given you the example for all the three modalities for the breast cancer per se. Similarly, you use all these three modalities as and when the need arises in various different cancers. So you may end up doing only radiation plus the systemic therapy or a chemotherapy when the surgery is not possible. You may end up doing only systemic therapy when the disease has become advanced and it is no more a local disease and it's spread out in the body. You may just wanted to attend it only with the systemic therapies. So I think that's the reason we generally require all these three modalities to be sitting together while we are making a treatment plan. There's a lot of tumor board discussions, there's a lot of multidisciplinary team discussions which happen whenever you have a cancer patient coming to us, and there's a plan which is specific and individualized to each patient which is drawn up, and all these three modalities are sequenced in the optimal manner there.
Well, these essentially constitute the standard of care modalities. And I want to come to you now, Dr. Ankur, with a question around advanced cancer treatment modalities. What makes them advanced? Why are they coined as such? How do they differ from standard of care options?
I would like to make a little correction. Many of the newer advances are now getting an standard care of care. So Dr. Bhuvan has quoted two terms, that was target therapy and immunotherapy.
Sure.
So what is target therapy? Each cancer cell is a different. Many of these cancer cells bear a marker. This is an important marker putting over this cancer cell which differentiate this cancer from other normal body cells.
Right.
Now science is evolving fast and we are diagnosing these markers increasing number day by day. And luckily, against many of these markers, we have a targeted agent, we have a drug which inhibit them and which kill the cells which bear the target. Luckily, these target therapy can be an oral form of tablet. It could be in a form of subcutaneous injection. It can be in the form of a IV therapy.
I see.
The second thing which I would like to incorporate as our newer advances is the role of immunotherapy. So our body has a defense mechanism, which is our immune system. Anything which goes in our body, like bacteria, virus, any foreign agent, even a cancer cell, our body act against it. But sometimes what it happens that cancer used to inhibit our body immune system, and our cancer body immune system doesn't recognize cancer cell as a foreign antigen.
Right.
So there is a thing which is called as immunotherapy, and this disbalances this equilibrium, and this increases our body immune defense mechanism to kill this cancer cell. So this is called as immunotherapy. These are two recent advances, and the importance of these advances are when we are discussing about the advanced cancer, especially the stage 4 cancers. So these targeted therapy and immunotherapy are working in stage 4 cancers, and they are increasing the life of the patients, putting very good cancer records.
It's time for a short break, but our special feature, I.O., a public awareness initiative by MSD Pharmaceuticals, continues on the other side. We'll be right back. Dr. Rajat, the month of June, of course, marks Cancer Immunotherapy Awareness Month. It's commemorated each year, right? So beyond what we've just heard, if you could break down immunotherapy in even more basic layman language for the benefit of our viewers.
So cancer is a very smart disease. It tries to suppress our immune system, our fighting capability, and that's how it grows on uncontrolled in the body. This is done by suppression of the T cells of the body, which are the immune cells. So what immunotherapy drug does, it goes into the body, it unlocks that inhibitory action. So the cancer cell has put the immune system under lock and key, and the immunotherapy, when it goes into the body, it unlocks this thing.
Sure.
It activates the immune system, and when the immune system gets active, it then fights the cancer. It's an indirect way of dealing with the cancer, but it is a very effective way of dealing with the cancer.
So let's talk more about that, and I'll come back to you now, Dr. Ankur. When we talk about the side effects, of immunotherapy, what do they typically constitute? What should a patient expect?
So immunotherapy is a fairly tolerated treatment. Rather than we should be discussing first about the side effects of the standard treatment, which is chemotherapy.
Sure.
Nowadays, even with the recent advances in the supportive care, chemotherapy is fairly tolerated. Yet some of the patient has certain side effects. The very common is alopecia, which is loss of hairs. The second is nausea and vomiting. With some chemotherapies, there could be an increased incidence of oral ulcers and diarrhea. So these are the common side effects which we expect from the chemotherapy. Now the advantage of both target therapy and immunotherapy is these side effects are not oftenly founded with them. The most common side effect associated with the immunotherapy in day-to-day life would be a fatigue. The second side effect is sometimes endocrine related, and we found thyroid dysfunction in these patients. If we are following our doctors continuously, then this doesn't produce many symptoms, and this could be diagnosed easily on a routine blood test. The other less common side effects of immunotherapy includes a skin rash. It could be, in some patients, it could go to a state where immune-related pneumonias or immune-related diarrheas can happen. But this occurs in fairly low number of patients. And majority of patients, immunotherapy is fairly well tolerable and doesn't affect day-to-day activities of the patients.
When it comes to immunotherapy, unfortunately, the myths that surround immunotherapy are many. So we're going to essentially ask our distinguished panel to participate in a myth-buster round to help us separate fact from fiction when it comes to immunotherapy. All right? So the first myth that I'm going to pose to you, and I'll pose this to you, Dr. Vineet, is that immunotherapy and chemotherapy are one and the same.
We need to understand they are fundamentally different technologies. Chemotherapy, when we say chemotherapy, we use it for a terminology for a drug, which basically goes into our body and kills our dividing cell. So if any cell in the body is dividing, so what it does, it selectively kills the dividing cell. And because the cancer cells are dividing rapidly, it selectively kills those cells.
Right.
The problem is there are normal cells also in the body which are dividing. You have hair cells, intestine cells, blood cells.
Sure.
So that is the cause of the side effects. So the entire field of technology which works on killing these dividing cells, you can call it as chemotherapy. Immunotherapy is a distinct field where actually it is not directly killing any cell. All the immune technologies, what they are basically doing is they are activating the immune system, which normally, see, all of our bodies every day new cells come, cancer cells also come, but immune system catches them early and kills them.
Sure.
When somebody has developed cancer, it is a failure of the immune system. The immune system is not able to catch the cell early. That is why it has grown and it is spreading.
Yes.
So what we are basically doing in all the immunotherapy technologies, we are boosting the ability of the body's immune cells to recognize and kill the cancer which they were not able to recognize and kill earlier. So it's a fundamentally very, very different technology. So absolutely I would say that there is no connection between the way chemotherapy might work and the way immunotherapy might work, because the way by which they work is very, very different.
Yeah, thank you for clarifying. And our next myth comes to you now, Dr. Ankur, which is that the side effects of chemotherapy and the side effects of immunotherapy are, equal or just as bad, just as severe.
No, ma'am. They are absolutely different. Immunotherapy is fairly tolerable, and the typical side effects which are associated with chemotherapy, that is hair loss, nausea, vomiting, diarrhea, it usually doesn't happen with immunotherapy. Approximately 70 to 80% of infusions of immunotherapy are fairly tolerable. Even we encourage our patients to go to their office and job on the same day after infusion is complete.
All right, excellent. And I'll pose my third myth to you, Dr. Bhuvan, which is that immunotherapy is strictly a last resort for cancer patients who've reached perhaps the most advanced stage of the disease.
So what happens, Pooja, is whenever a new drug is introduced, it's usually introduced in the latter lines. Once a disease has metastasized, it's been treated with the standard of care drugs, and that's when the newer drugs come in. But I think that was the last decade. What has happened in the last 10 odd years is that the immunotherapy has made its mark, or has made its way one by one to the first line now. So when I say first line, it's not first line in the metastatic setting, that's in the spread out setting. It's made its way to the first line in the localized setting. And here again, I would like to draw an example from the breast cancer, because I think it's easier. It's the most recognizable cancer. It's the most common cancer in Indian women. In a triple negative breast cancer, it's a pretty scary cancer in a younger women especially. You do immunotherapy as a first step along with chemotherapy before the surgery.
Okay.
And why you do that is because immunotherapy trains your body's immune system to kill the cancer cells. And that's what Dr. Rajat Saha and Dr. Ankur has been, once they try to tell the mechanism of it. So it not only kills the cancer cells, it also develops long-term memory for your immune cells to keep killing them as we stay. So, for most of the drugs, for most of the disease conditions, immunotherapy, in wherever it is active, has made its way in the pre-operative local stage setting also. So as most of my learned colleagues will tell you that immunotherapy is no more the last resort, rather it is the first resort in majority of these cancers. And I think that's a brilliant thing, because that has led to long-term survival possible for these patients.
Sure. Well, thank you for sharing that and for, putting our attention there. And the fourth myth comes to you now, Dr. Vineet, and that is that immunotherapy only works on a select few type of cancer.
Yeah, so this is a myth with a grain of truth, I would say. So see, it's so when immunotherapy started off, there was a recognition that every cancer is not sensitive to immunotherapy.
All right.
Because see, the immune blockage mechanism plays a major role in some cancers and plays a minor role in some cancers. So if you stop the immune blockage process, you will get a better result in some cancer and you will get a worse result in some cancer. But what has happened over time is there is an increasing realization that these immune blockage mechanisms are common to very, very large number of cancers. So I would say at least, 25 or 30 or maybe even more cancer of the body have some kind of immune blockage mechanism. So what has happened is over time, when immunotherapy started out, it used to be used in a few cancers, skin cancer, lung cancer. Over time, the number of cancers where immunotherapy has been found to be useful has increased. Number two is that the kind of immunotherapy which is available has also improved. So earlier, the kind of immunotherapy which was available, probably it was less effective in some cancers. But what is being developed now is immunotherapy technologies are more potent and can work on a wider array of cancers. So we are seeing its role expand over time. So if you look at the last decade, we have seen the role of immunotherapy. Suppose in my clinic, I would, if 10 years back, I would get maybe, suppose out of 10 patients, suppose I might give immunotherapy to one patient. But in the current era, the role is expanded so much that you might have the option of immunotherapy in maybe 50 to 70% of your. So with time, the role is increasing, and I think it will increase even more.
It certainly
and
seems
in
like
parallel,
a game changer.
Absolutely, and the outcomes are also improving in parallel. So I think more options we get, the better the survival and better the outcome for our patients.
And Dr. Rajat, I'll come to you with the fifth and final myth, which is that immunotherapy in India is only available in certain very limited centers across the country. Your response?
No, I don't think so. Again, when the immunotherapy developed, yes, it started off in a very few apex research institutes of the country.
Sure.
Subsequently, as Dr. Ankur has also mentioned, the side effect profile is very well managed, better managed than chemotherapy. It is a very versatile molecule. It can be used in combination with chemotherapy. It can be used in all stages of the disease. And nowadays, it is now available in almost all the good cancer centers of India. So it is not only limited to a very select tier 1 city. No, it is available pan-India, I would say.
A lot of reason for optimism when it comes to the conversation around immunotherapy. With that, gentlemen, thank you so much for taking the time to speak with us. We salute everything that you do on a daily basis to eradicate cancer in this country, and we wish you all the very best for what lies ahead.